If you've been scratching your head over complex diagrams and getting lost in the sea of numbers, don't worry, we're here to make arterial blood gas or ABG simple. The row method and other ways of remembering, although important, don't really cover the partial and full compensation that we have to go over. We're going to use the concept method for that. This approach has helped me solve every ABG question correctly and easily. Let us talk about the actual three-step ABG interpretation. The first thing to determine whether the disease is acidosis or alkalosis, the pH scale, which is the keystone to understanding the pH scale. A good tip that I use to remember acidosis and alkalosis is thinking of the alphabet. C comes before L, just like 7.35 comes before 7.45. If the pH is less than 7.35, it is acidic. If it is above 7.45, there it is alkalosis. Now, that's the only thing you have to remember. Just pay attention to the pH. Then we must understand the second step, which is to determine if this is respiratory or metabolic. PaCO2, or carbon dioxide, is controlled by your lungs, and HCO3, or your bicarb or bicarbonate, is controlled by the kidneys. Your lungs and kidneys work together to maintain a normal level of pH, and I will explain it further in step number 3. If CO2 is abnormal and HCO3 is normal, respiration occurs. If HCO3 is abnormal and CO2 is normal, a metabolic condition probably exists. Hyperventilation 9 times out of 10 causes respiratory alkalosis, and the way to fix that is using a paper bag. It sounds silly, but it will be on your exam. Let's give an example. We know it is acidic because the pH is 7.25. If PaCO2 is 50 and above the normal range, it means that there is a breathing problem. And at 24, we have respiratory acidosis because our bicarb is normal. You might be wondering, what if your PaCO2 is abnormal and your bicarb is abnormal? Or what if your pH is normal and both of them are abnormal? These are examples of what we call compensated ABGs, and these can get really tricky. That brings us to our third step, which is to determine whether the problem is compensated. In compensated states, the body tries to balance the pH by changing the CO2 or the bicarbonate, which is a really amazing thing for survival. If both are within the normal range, there is no compensation. But if these are outside the normal ranges, well, then the body has to compensate for what it's losing. Let's take an example. The pH value is 7.3, which is acidosis. A PaCO2 of 50 indicates respiratory acidosis because the pH and PaCO2 are on the acidic side. Since bicarb is 49, the body is trying to compensate by increasing the bicarbonate, but this is not enough to return the pH to normal. This is partial compensation. Let's take another example. The pH value is 7.5, is an alkalosic stage. And since the pH and PaCO2 of 51 contraindicate the pH of 7.5, and the bicarbonate of 49 is alkalotic, this is a metabolic alkalosis, which is the body is trying to compensate by increasing the CO2, but this is just not enough to return the pH to normal. So this is a partial compensation again. In our last example, since the pH is at a normal range and the body compensated to bring back the pH to a normal level, this is fully compensated ABG. And there's two ways to solve this problem. One is know the patient's diagnosis. And number two, which we will focus on more, is the acidic and alkalytic side. Even though the pH is at a normal range, which side is it closer to, acidic or alkalotic? Since the pH is leaning towards more on the acidic side and the CO2 is in acidosis, we can assume that the body was acidic and was compensated to bring back the normal pH range. Thus, we can conclude that this is respiratory acidosis and is fully compensated. Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.